Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal video today. So we have some quite dry earwax plug removals to show you. So you see this first patient here has some very dry wax. We've introduced a bit of olive oil in here just to help to detach the plug from the canal wall and to help it slide across the skin. We've got a better chance of getting this out in a larger piece if there's a bit of oil around it. So we've got the standard size Zollner tube in here. We're just popping that in to take that first little chunk of wax away. You can see we're aiming towards the bottom of the piece if we can to lift it up into the center of the canal, detaching it from the canal wall. You can see it's starting to come away, so we just moved the left hand side away. We've got a good grip there. As with a lot of these dry pieces of wax, sometimes you'll get the grip and you'll get the wax moving, but whether you can maintain that suction grip to be able to pull it out against the shape of the canal wall, especially with a larger piece like this, we're aiming for the slightly smoother surface there on the top to see if we can just wiggle this. There you go, it's just sort of moving it up and down. You can see it's quite firmly wedged in there. Just trying to maneuver this out. Just pulling the top section, just working it up and down. There you go. See it start to come away, a little bit broke away there. It's almost out. Sometimes as you're pulling it out, you'll get a larger piece that's sitting just behind that just kind of stops it, but there we go. So there's the piece we took out. Have a good look behind that. Here we are. Just see a little bit of discoloration to the top of the canal wall, but other than that, it looks pretty good. So this is the same patient now with the second ear. You can see we've got a little gap at the top there. Quite a large plug again. So same as before, introduce a little bit of olive oil. Lots of people ask when we mention olive oil about the different types. This is classed as surgical grade olive oil, which basically means it's just been filtered a lot more. You can just see it's just starting to work off that bottom canal now. Looks a little bit drier, this piece, so there's a little bit more crumbly. Aiming for that bottom section there. I know I've mentioned a couple of times recently, but you have to kind of maneuver this as it detaches. You have to almost double back on yourself a little bit as you remove this from the canal. So you have to kind of aim forwards, then bend it to the left to get it out, and then bend it back to the right then to get it around the corner. So there's a little bit of maneuvering needing doing. And sometimes you'll work the front end out, but what you'll have behind that then is a slightly different shape of wax, which just holds it in place. So that's what we've got here. So we're going to use the Jobson horn now just to try and push it down and just guide it out a little bit more. So I'm pushing into the center of the wax there, pulling. You can see it's just broken that kind of squishier central section out. So we managed to get behind it now, rolling that forwards, aiming to get behind it again. There you go, pushing down and forward to try and get this out in one chunk. You can see it's starting to break, so we're going to change position, go further back in. Now we're starting to see the back end rising up, look. There you go, out he pops. Here's the piece of wax. So we'll take a look behind that. A little flake of dry skin at the base of the canal. Eardrum looking good. So these are the two plugs we removed. So one just over just over a centimeter each. So 1/2 inch. You can see the very dark colour there, so quite old pieces of wax. This one you can see the wax looks a little bit softer at the entrance here. So we're just going to lift this off that front section. You can see it's a little bit softer at the front end, which is great because that's perfect. If you've got the softer section, you really kind of beds the suction tube into it as it suctions on it, with a harder section underneath so it holds everything in place. There you go, coming out really nicely. Long strip of dry skin sitting behind it as well. Take a look behind there. And there we are. There's the eardrum. So you can see here we had the plug of wax to the left and that dry flap of skin which has been holding everything in place, anchoring it all in place. So a nice easy one to do there. Okay, so we're going from an easy one to a little bit more difficult one. A few things going on in this ear canal at the same time. We've got some very dry, sticky wax, and we haven't introduced any olive oil in here because patients already been oiling this. We've got a very narrow entrance, so not an ideal combination to have the very narrow canal and the very sticky wax, because as you've seen from previous videos with sticky wax, as you tend to maneuver it, what does tend to happen is it sticks from one canal wall to the other. Well, if you've got a very narrow ear canal like this one, as we're maneuvering it left and right, obviously it just sticks straight away to the opposing canal wall. So what I'm aiming to do here is to pull down from the top, so to try and roll this wax forwards. So instead of wiggling back and forth left to right, we're going to go up and down and bring it sort of towards the entrance to the canal. I'm not going in too deeply at the moment just because it's difficult to accommodate the standard size ulnar tube in here, and this wax is so tough that if you try to remove this with a fine end, it would just completely block the fine end. You just wouldn't get the suction grip on the center of this wax to be able to pull it out. So you can see we're wiggling up and down. You see it just stretching and pulling from deeper inside the canal. See it aim in just slightly higher every time and try to pull the wax down. Got a chunk there stuck at the bottom, so we're just going to break that piece. You can see it's broken away there, so clear that out the end of the suction. Aim at top again, aiming higher, using the suction tube not only as the tube, but using the leading edge of the suction as well, just to kind of break off little bits of sticky wax. Now we've pulled a lot down from the top, we're going to lift from the bottom again, see if we can get some movement. Not quite there yet. You can see more than it kind of move in, it's just squished and stuck everywhere. Pulling down from the top has created a little bit of a gap there at the top, but very tough stuff. So we're going to switch tools now. We're going to go in with a Jobson horn. So because it is really sticky, sometimes with a Jobson horn you're lucky and you can kind of bend it and flatten it out, and then you can get to a much deeper piece. And because of the sticky nature to the wax, it stays together really nicely, and you can pull that out then. But you can see we're aiming further back, try to bring this forwards out in one piece. You can see it's flicking it forwards. It's just bringing the top kind of portion of the wax out rather than kind of rolling it and all come out at one go. So we're just flattening this top section just so we can get a good grip, a good visualization, sorry, not good grip. So you can see we're trying to get this one. You can see how sticky this is. I can't even pick it up with the Jobson horn, like it's still attached further in. So we're going to aim much further in now. So we're going to aim for that little gap there at the top, press down, bring that section forwards, get that out of the way, out of our view. There you go. Just wipe that bit off the end of the Jobson. Back in again now. We can just see a bigger gap. We start, there you go. We can start to see the back end of this wax now. So pulling this forwards as well. There you go. And again, brill. There you go. Out it pops. And a little bit of difficulty, you just see it off camera, a little bit of difficulty picking that bit of wax up. So we can see the eardrum now. There's the eardrum there, looking nice and healthy. There's a little bit of sticky wax at the entrance here. A very thin layer on top of the skin, so we'll just give that a quick once over. There you go. Just want to take some of that sticky bits out of there. And again, just basically doing a little tiny bit of tidying up in here. And there we are. There's the eardrum. So this is the same patient now, but their second ear. So we can see we've got little hairy bits in here. The wax itself is quite angular, so not the easiest of wax to work on when it's this angular. Little bit of a gap at the top here. Still very narrow though. So I'm just using the standard size Zollner tube here just to clear some of this stickier wax on the entrance. We do get another question we get asked quite a lot is, why do you sometimes just leave the wax at the entrance of the canal? If there's wax at the entrance of the canal, but I can see it's not going to interfere with getting the deeper wax out, I will leave it there and tidy it up afterwards. If, like this, you've got a very sticky wax and you've got a very sticky piece at the entrance to the canal, then that is going to stop the wax from deeper in coming out. You can see it's starting to come away there. So we will remove that piece first, or as much of it as we can. So that's got rid of the kind of piece that was obstructing the view at the front. We've got a little bit of dry skin just lifted up there. We've managed to get a grip on this angular piece at the front, moved it across to the right so we can work on the flatter edge rather than the very narrow edge, which wouldn't give us a very good suction grip. So just trying to get a good grip, just pressing into the wax slightly there, so it means we get a better grip. As you can see, a lot more of it came away. There we are. So there's that piece with all the little hairy bits on it, and there's the eardrum there, looking nice and healthy. So this is what we removed. So the big lump up to a centimetre was from the first ear. From a centimetre onwards, that is what came out of the second ear. So you can see that reddy brown chestnutty colour, which is usually a sticky wax. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already or you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.